Okay, ready to dive deep into postpartum complications? We've got tons of research here, and you might be thinking, why focus on problems after such an amazing experience?
Right, right.
But honestly, knowing what could happen is so important for your health, like knowledge is power and all that.
Absolutely. The goal isn't to scare anyone, but to give you the info you need to have the smoothest recovery possible.
Exactly. It's all about being prepared, right?
Right.
So let's start with something pretty intense sounding.
Yeah.
Postpartum hemorrhage. What exactly is that?
So postpartum hemorrhage, PPH for short, is basically bleeding too much after you give birth.
Okay.
Like losing over 1,000 milliliters of blood within 24 hours of delivery.
1,000 milliliters. Whoa, that's a lot. Why is that such a big deal?
It's a big deal because it's the leading cause of, well, maternal death around the world.
Seriously.
But the good news is that with the right care, something like 90% of those cases are preventable.
Okay, that's both scary and reassuring at the same time.
Yeah.
So what causes all that bleeding?
Well, think about it. During pregnancy, your body increases blood volume to, support the baby.
Makes sense.
But after delivery, your uterus has to contract, like really firmly, to close off those blood vessels where the placenta was attached. If it doesn't contract right, those vessels stay open and you can bleed heavily.
So it's like the uterus needs to be its own tourniquet.
Exactly. And the most common reason it doesn't clamp down right is something called uterine atony.
Uterine atony.
Yeah, and sometimes even a full bladder can stop the uterus from contracting the way it should.
Okay, so how would a new mom even know if her uterus isn't contracting right? What should she look out for?
That's a great question. So if your uterus feels soft and mushy, almost like a deflated balloon instead of firm like a grapefruit, that's a red flag.
Okay.
Heavy bleeding, like soaking through a pad every hour or less, is another one. And of course, pain, dizziness, or feeling faint. Those are all reasons to call your doctor ASAP.
Got it. So trust your gut. If something feels off, speak up.
Exactly. Now, there's this handy mnemonic, to help remember all the causes of PPH, the 5 T's.
Ooh, I love mnemonic.
Yeah. So the 5 T's are tone, tissue, trauma, thrombin, and traction.
We've already talked about tone, right? Like the strength of those contractions.
Right.
Okay, so what about tissue? What does that one mean?
Tissue means anything left behind in the uterus after delivery, like placental fragments or blood clots. These can prevent the uterus from contracting fully, and that leads to more bleeding.
Okay, that makes sense. And trauma.
Yeah, trauma means basically any physical injury during delivery.
Oh.
Lacerations, tears, even a rare thing called uterine inversion, where the uterus turns inside out.
Oh, wow.
Sounds scary, but doctors are trained to, handle this situation.
Okay, that makes sense. Now, I'm curious about thrombin. Does that have something to do with blood clotting?
You got it. Thrombin refers to problems with blood clotting. If your blood doesn't clot right, even small injuries can bleed a lot.
So is that like a pre-existing condition or something that happens during pregnancy?
It can be both, actually. Some women have inherited bleeding disorders, and others develop clotting issues specifically during pregnancy.
So many things to think about. Okay, let's get to that last T, traction. What's that all about?
Okay, imagine the placenta is like Velcro stuck to the uterine wall.
Okay.
Traction is like pulling on the umbilical cord before the placenta has naturally separated. This can cause tearing, more bleeding, and even that uterine inversion we mentioned.
Okay, so no tug of war with the placenta. Doctors know better than to do that, right?
Absolutely. But in rare cases, especially emergencies, it can happen. That's why knowing about these 5 T's is good. It helps you ask questions and, advocate for yourself if something feels wrong.
Absolutely. Being informed is so important. So we've talked about PPH. What about blood clots? Pregnancy already increases the risk for those, right?
It does, yeah, significantly. You're actually 10 times more likely to develop a blood clot that's also called venous thromboembolism, or VTE, during pregnancy and postpartum compared to when you're not pregnant.
10 times? That's a huge jump. Why is that?
Well, pregnancy causes a lot of changes in your blood flow and clotting factors, to support the baby. These changes, along with less movement after delivery, create a good environment for clots to form in the veins, especially in the legs and pelvis.
So what makes those blood clots so dangerous?
The real danger is if a clot breaks loose and travels through your bloodstream. If it reaches the lungs, it's called a pulmonary embolism, and that can be life-threatening.
Yikes. That sounds serious. What are the signs of a blood clot that we should be watching out for?
There are actually different types of blood clots. Some are called superficial venous thrombosis, or SVT, and they're less serious, affecting veins close to the skin. You might see pain, swelling, and redness, usually in the calf.
Okay, so what about those deeper, more serious clots?
Those are deep vein thrombosis, or DVT. They affect veins deeper in the legs or pelvis, and they can be harder to spot because sometimes there aren't any noticeable symptoms.
Oh, that's scary. So how would you even know you had one?
Well, that's why knowing your risk factors is so important. If you have any unusual leg pain, especially with swelling or warmth, tell your doctor right away. Don't wait.
And what about that pulmonary embolism, the really serious one? What are the warning signs for that?
A pulmonary embolism can feel like a sudden attack. You'll probably have shortness of breath, chest pain, and a racing heart. It can even seem like a heart attack. If you have any of those, get medical help immediately. Time is really important.
Wow, okay. It sounds like staying active after delivery is key to preventing those blood clots from forming in the first place, right?
You got it. Getting those legs moving, even if it's just gentle walks around the house, is one of the best things you can do.
All right, so we've covered hemorrhage and blood clots. What about another potential issue? Infections.
Infections are definitely something to keep in mind. After delivery, your body is more vulnerable to infections, especially if you had a C-section or any tears during childbirth.
So what are the most common types of infections that new moms might get?
One of the most common is endometritis, which is an infection of the lining of the uterus.
I can imagine that being pretty painful. What are the signs of endometritis?
The usual signs are lower abdominal pain, fever, a bad smell from vaginal discharge, and just generally feeling unwell.
And what about infections in the incision site, like after a C-section?
Those are called surgical site infections, and they can happen after any surgery. Just keep an eye on your incision, watching for redness, swelling, pain, or any pus-like drainage.
Okay, those sound pretty obvious. What about UTIs? Aren't those common after delivery?
Yeah, they are. Urinary tract infections, or UTIs, can happen because of catheterization during labor or because your bladder might not empty completely after giving birth.
Okay.
The typical symptoms are pain or burning when you pee, needing to pee more often, and sometimes lower back pain or fever.
All right, so we've got infections of the uterus, surgical incisions, and the urinary tract. Are there any other types that new moms commonly get?
Yes, there's mastitis, especially for women who are breastfeeding.
Mastitis, that's an infection of the breast tissue, right?
Exactly. It can happen because of a blocked milk duct or bacteria getting into the breast through cracked nipples.
Okay, so what should we be watching out for with mastitis?
You'll probably have flu-like symptoms like fever and chills. The breast will be red, tender, and warm to the touch.
Okay, so a red, hot, and painful breast is a definite sign to call the doctor, right?
Absolutely. Early treatment with antibiotics is really important to stop it from getting worse.
This is all super informative, but also pretty intense.
Right.
All these potential complications. It makes you wonder how anyone enjoys those first few weeks with a newborn.
I know it seems like a lot, but remember, these complications aren't what usually happens. Most moms recovered just fine.
That is reassuring. But let's not sugarcoat things. There's another big hurdle we need to talk about, mood changes.
You're right. Those hormonal changes after delivery can really impact your emotions.
So are we just talking about the baby blues, or is there more to it?
The baby blues are very common, affecting up to 80% of new moms. They usually start a few days after delivery and last a week or two.
Yep.
You might feel tearful, irritable, anxious, or just totally overwhelmed.
Okay, that sounds manageable. But what if those feelings stick around longer than a couple of weeks?
Then it could be something more serious, like postpartum depression or PPD.
Now it's getting interesting. How is postpartum depression different from the baby blues?
PPD is a lot more intense and lasts longer. It's not just feeling a little down, it's constant sadness, anxiety, hopelessness, and even guilt.
Wow.
It can affect your sleep, your appetite, and even how you bond with your baby.
That sounds really tough to deal with, on top of recovering from childbirth and taking care of a new baby.
It is. And it's important to remember that PPD is a real medical condition that needs treatment, just like any other type of depression.
Absolutely.
Yeah.
What are some signs of PPD that new moms should watch for?
The symptoms can be different for everyone, but some common ones are losing interest in things you used to enjoy, changes in your sleep or appetite, having trouble concentrating, feeling worthless or guilty, and even thoughts of harming yourself or your baby.
Whoa, those are some serious red flags. What should someone do if they're experiencing any of those symptoms?
Get help right away. Talk to your doctor, a therapist, or a trusted friend or family member. There are treatments that really work, like therapy and medication.
Okay, so we've covered the baby blues and postpartum depression, but isn't there another even more serious type of postpartum mood disorder?
Yeah, there's postpartum psychosis, which is a lot rarer but much more serious.
How is postpartum psychosis different from PPD?
Postpartum psychosis involves being disconnected from reality. You might have hallucinations, delusions, paranoia, really fast mood swings, and jumbled thoughts.
That sounds terrifying. Is it dangerous?
It can be. Postpartum psychosis is a psychiatric emergency that needs medical attention immediately.
We've covered some heavy topics today, but I think it's so important to have this information.
Right.
Like you said earlier, being informed is key.
I agree. Being aware of these things helps you get help when you need it and stand up for your own health.
So before we wrap up this part of our postpartum deep dive, what's the one thing you want our listeners to remember?
I think the most important thing is to pay attention to your body and your mind. If something feels off, don't wait, speak up, and get help. You're not alone, and there's support out there.
That's such great advice. And we'll be back next time to dive even deeper into these postpartum complications and talk about how to manage them.
Welcome back. Let's dig a little deeper into how to handle some of these postpartum complications. We'll start with postpartum hemorrhage.
Okay, so we talked about those 5 T's that can cause PPH. But what actually happens if a new mom starts bleeding heavily after delivery? Like, what's the first thing they do?
Well, the first thing is to help that uterus contract and close off those blood vessels. It's kind of like encouraging a muscle to, flex and do its job.
So like giving those uterine muscles a pep talk.
Exactly. And usually the first step is a uterine massage. A nurse or doctor will gently massage the abdomen to stimulate the uterus to contract.
I've heard of that. But what if the massage doesn't work? What happens then?
That's when we use medications. We have these medications called uterotonics, and they're designed to help the uterus contract, more strongly.
Okay, tell me more about these medications. What are they like?
One of the most common ones is oxytocin, sometimes called pitocin. It's often given right after delivery to prevent hemorrhage from even happening.
Oh, right. I remember getting pitocin after both of my deliveries. It definitely made my uterus feel like it was working.
That's exactly what it's supposed to do. And there are other medications too, like misoprostol, methylorganovine, and carboprost. They can be used if oxytocin alone isn't enough.
So many options. I imagine each medication has its own pros and cons, right?
Of course. Each one has potential side effects and things we need to consider before using it. For example, methylorganovine isn't a good choice for women with high blood pressure.
Good to know. So let's say those medications and the massage aren't doing the trick. What happens in those more serious PPH cases?
In those situations, there are other procedures to control the bleeding. Things like balloon tamponade or even surgery.
Balloon tamponade? That sounds interesting. What's that all about?
It might sound a little strange, but it's a really effective technique. It involves putting a special balloon into the uterus and inflating it to put pressure on those bleeding vessels.
Wow, that sounds like a pretty serious intervention. Well, let's move on from PPH and talk about blood clots. What can new moms do to stop those from forming in the first place?
Getting up and moving around as soon as possible after delivery is really important. It gets the blood flowing and lowers the risk of clots.
That makes sense. But what about women who have had C-sections? They can't exactly jump out of bed and start running, right?
Of course not. But even little leg exercises in bed, like ankle pumps and knee bends, can make a big difference. And as soon as they can, short walks around the room or hallway are great.
What about those compression stockings I see a lot of new moms wearing? Do those actually help?
They can definitely help. Compression stockings gently squeeze the legs to help blood flow and keep blood from pooling, which can lead to clots.
Okay, good to know. What if someone does get a blood clot, even if they're doing everything right? How do they treat that?
The usual treatment is medication called blood thinners, or anticoagulants. These meds help keep the clot from getting bigger and lower the risk of it breaking off and traveling to the lungs.
So they basically help keep the blood flowing smoothly, like a traffic cop directing traffic.
That's a great way to think about it. There are different kinds of blood thinners, and your doctor will decide which one is best for you.
This is all super helpful. Now let's talk about infections. We know good hygiene is important, but is there anything else new moms can do to prevent those postpartum infections?
You're absolutely right. Good hygiene is the foundation. Washing your hands often, especially before and after touching your perineal area or taking care of your baby, is super important.
And keeping that perineal area clean and dry, right?
Exactly. Change your pad often and always wipe from front to back to keep bacteria from spreading.
Okay, those are good basic tips. Are there any specific strategies for preventing particular types of infections?
For sure. For instance, if you had a C-section, keeping the incision clean and dry is key. You should watch for any signs of infection, like redness, swelling, or drainage.
Got it. And what about mastitis? Anything breastfeeding moms can do to lower their risk?
Making sure your baby is latching on correctly is really important. A good latch helps prevent sore or cracked nipples, which it can let bacteria in.
That makes sense. Any other tips for preventing mastitis?
Emptying your breast completely at each feeding or pumping session is important. It prevents milk from building up and potentially causing problems. It's also a good idea to switch up breastfeeding positions to make sure all areas of the breast are drained properly.
So much to learn about breastfeeding. Speaking of learning, let's go back to those postpartum mood changes. We talked about the baby blues and PPD, but can you explain what causes all those emotional ups and downs?
Of course. The big hormonal shifts after delivery play a huge role. The levels of estrogen and progesterone, which are really high during pregnancy, drop quickly after birth.
And those hormonal changes can send our moods on a roller coaster ride.
Exactly. It's like your body's chemistry is going through a major readjustment, and your emotions are definitely affected.
Like the ultimate hormone hangover.
Hmm.
Aside from hormones, are there other things that contribute to postpartum mood disorders?
Absolutely. Sleep deprivation is a big one. Those sleepless nights can really affect anyone's mental health.
So true. And I can imagine the stress of adjusting to life with a new baby can be super overwhelming too.
You're right. The demands of caring for a newborn, plus the physical recovery, can be a lot to handle.
And then there's the pressure on women to bounce back and be the perfect mom, which probably adds even more stress.
Absolutely. Those expectations can be really harmful. It's important to remember that there's no such thing as perfect, and it's okay to ask for help.
So true. So we've talked about the causes,
Right.
but what can we do about those mood changes? What are some good treatments for postpartum mood disorders?
There are a few options, and the best approach often involves a combination of things that are personalized for the individual.
Like what? Tell me more.
Therapy is often a key part of treatment. Cognitive behavioral therapy, or CBT, is especially helpful for postpartum depression and anxiety.
How does CBT work? Is it like talk therapy?
It is a type of talk therapy, but it focuses on identifying and changing those negative thought patterns and behaviors that contribute to the difficult feelings.
So you're basically retraining your brain to think more positively.
Exactly. You're
Right.
challenging those unhelpful thoughts and replacing them with more balanced and realistic ones.
I like that. What about medication? Is that an option for postpartum mood disorders?
It can be. Antidepressants are sometimes prescribed to help balance those brain chemicals that are involved in depression and anxiety.
But are antidepressants safe to take while breastfeeding? A lot of moms worry about that.
That's a great question, and it's definitely one to discuss with your doctor. Some antidepressants are considered safe during breastfeeding. Your doctor can help you weigh the risks and benefits and make the best choice.
Okay, that's good to know. We've talked about therapy, medication. What else can help with those mood challenges?
Don't underestimate the power of support. Having family and friends who can help out, both emotionally and practically, can make a huge difference.
Yeah, I can see how that would be so helpful. Just having someone to listen or help with the baby can be a game changer.
Absolutely. And for some moms, joining a support group with other new moms going through similar things can be really helpful. These groups provide a safe space to connect with people who understand what you're going through.
It's so important to know you're not alone.
Exactly. Sometimes just hearing from other moms who have been there and come out the other side can be really reassuring.
We've covered a lot, but there's one big question we haven't answered yet. What can partners, family members, and friends do to support new moms who might be dealing with these postpartum challenges?
That's a great question, and it's one that deserves a deeper look. Luckily, that's exactly what we'll be doing in part 3 of our postpartum series. We'll discuss how important support networks are in helping new moms get through those tough times and thrive in their new roles, so stay tuned for that.
Welcome back to our deep dive on all things postpartum.
Yeah.
So far, we've tackled those physical challenges like hemorrhage and blood clots and infections.
Yeah.
And of course, we couldn't forget those emotional roller coasters, from the baby blues to PPD.
Right.
But now we're focusing on something super important for postpartum recovery, your support network. Because let's be real, no one should have to go through this alone. Partners, family, friends, they all play a huge role in helping new moms navigate, well, everything that comes with this transition.
Definitely. And the kind of support someone needs can be different for everyone. Sometimes it's practical help,
Right.
like making meals, running errands, or just holding the baby so mom can shower or, take a nap.
Oh, a nap. Those were like gold in those early days. I would have done anything for a solid hour of sleep.
Exactly. And sometimes the best support you can give is just listening, offering encouragement, and just letting them know that their feelings are valid, especially when everything feels so overwhelming.
So it's about making them feel safe and supported to just be themselves, right?
You got it. Postpartum recovery isn't just physical, it's emotional and mental too.
Right.
And that's where that support network is so important.
Okay, so let's talk specifics. What are some things partners can do to actually support their loved one during this time?
Well, first off, partners can be proactive and learn about what to expect. That means reading up on common postpartum challenges, like those 5 T's of postpartum hemorrhage we talked about,
Yeah.
understanding the signs of mood disorders, and knowing when to get professional help.
Knowledge is power, for sure. But besides reading and research, what are some, hands-on ways partners can help out?
Sharing those night feedings, changing diapers, rocking the baby, all those things that might seem small can make a huge difference for a new mom who's probably exhausted. It lets her rest and recover, both physically and mentally.
And don't forget about just being there for her. Being a listening ear and a shoulder to cry on can be so valuable when things get tough.
Absolutely. And partners, remember to take care of yourselves too. Don't be afraid to ask for help when you need it. You can't pour from an empty cup, right?
So true. Okay, so we've talked about partners. What about family and friends? What can they do to support a new mom?
They can offer practical support, like bringing meals, helping with chores around the house, or running errands. Those things can free up so much time and energy for a new mom who's juggling a lot already.
And sometimes, just giving mom a break by taking the baby for a walk is the best gift you can give.
For sure. It's all about offering help that's actually helpful and appreciated.
Right.
And sometimes the easiest way to be supportive is to just ask, what do you need?
That's a really good point. Don't assume you know what's best, just ask. And if the new mom seems hesitant to ask for help, offer specific suggestions. Like, hey, want me to bring over dinner tomorrow? Or can I watch the baby so you can get a nap?
Exactly. Sometimes people just need a little push to accept help.
Yeah.
And remember, even small things can make a big difference. A quick phone call to check in, a nice text message, or a little gift from mom can go a long way in making her feel loved and supported.
So true. It's often those little things that have the biggest impact. And friends and family, don't be afraid to talk about postpartum mood disorders if you're worried.
That's so important. We need to get rid of the stigma around mental health, especially for new moms. It's crucial to create a culture where they feel comfortable asking for help.
Couldn't agree more. If you see signs of depression or anxiety in a new mom, gently let her know you're concerned and encourage her to talk to her doctor or a therapist.
And remember, listening without judgment is so important. Just having someone to talk to who gets it can be really healing.
Well, I think this has given us a really good look at how important support networks are for postpartum recovery. It's clear that no one should have to go through this alone. We all need a village.
I agree. Having strong support can make all the difference in a smoother, healthier, and happier postpartum experience. It's about surrounding new moms with love, understanding, and practical help so they can really thrive in this new chapter of their lives.
That's a beautiful way to put it. And on that note, we'll wrap up this deep dive into postpartum complications. Remember, you're not alone on this journey. Whether you're a new mom, a partner, family, or a friend, reach out, offer support, and let's build that village together.
To a healthier and happier postpartum for everyone. Take care.